got a lifetime of knowledge.
Let me call Mimi.
Are you freaking out about Taylor Swift?
I was about to say, do you know what day it is?
No, what day is
day
it?
that TS12, aka Taylor Swift's 12th album, was announced.
Oh my gosh.
Do you know
very
what it's
exciting.
called?
No, tell me.
It's called Life of a Showgirl, I think it is. Life of a
Ooh,
Showgirl.
as in like her Eras tour? Do we think
Yes,
that's the...
she can do no wrong, and I
She
support
can do
her.
no
And
wrong.
she's announcing more details on the New Heights podcast, which is Travis Kelce and I forget his, but Jason Kelce's
Jason?
podcast tomorrow.
Oh,
So.
very exciting.
What else happened today?
Well, I mean, did you like the wedding pics?
Oh my God. Most importantly, the wedding pics. Yes. Insert slideshow of Caitlin and Steven's wedding pics here.
Yes. Yes.
Yeah, they're so beautiful. Is it
No,
so fun
she
to
did-
relive them?
It's so fun. I also feel like we've just, because we're like trying to figure everything out life-wise right now, just having that little bit of like, oh, remember this super fun time that happened a few months ago? We're like,
Remember
so-
when we got married? I
remember
know.
when we got married. She did such a good job. Shout out Haley takes photos.
Yeah, no, they're truly stunning.
No, and then I'm wearing our matching necklace. I was like, oh, I'm gonna put something Lundie.
Cute. I know you
and
look
put it
very
on.
nice. It's just freezing in Cape Town, so
I
I have to be in a giant sweater.
As you
all
should.
time.
As you said.
But you look very cute for our
Thank
second
you.
ever episode. I did spend another like 2.5 hours editing the first episode today. It takes
Did you?
so long to do, like,
It does.
yeah, the learning curve of the
It's a learning curve.
captions and everything. So
Yeah.
that will be done hopefully soon. And edited my very first reel.
Well done.
Also way more time consuming than I anticipated.
I don't know what I expected coming into this, but it's so much work doing a
It's so much
podcast.
work.
So much work.
I've always said people don't give content creators enough credit. It is a full-time job and then some, truly.
No, and also I feel like I'm studying for a test. For those who can't see, I have like a million papers around me prepping for this episode. I've watched, I think, a million hours of Dr. Lucky online talking to all these things. Also because this topic is so important and I don't want to mess it up.
No, it's going to be great. I feel like there's been so much organic conversation around it over the
Totally.
past couple months. And she's also just such an incredible speaker. Like
No,
she's
she's so cool.
Yeah, so cool.
I
Also,
know.
not to, bring us down a notch or anything, but
Tell
she's
me.
been on recently some of our most favorite podcasts. She's going on the
Yes.
world's first podcast with Aaron and Sarah Foster. We saw she's been
Lundie's Girl
on
Crushes.
Oversharing, I think is what it's called, Jordana's podcast from Betches. So we are in
Yeah.
very good company.
Yes, go
no,
us.
she's-
Well, let me go into some of these stats that I found out because I know you told me to only have 3 stats, but I have 6.
Lay them on me.
Because it's so crazy. Okay, so going into this, I wanted to just understand a bit more clarity on egg freezing as a whole. It's crazy how much has exploded in popularity. In 2009, only 475 women froze their eggs.
In
In
2009.
2009, when we were in high school.
Wow. That
Yes.
is crazy. And how much is it annually now? Do you know?
And then by 2022, the numbers surged to 29,000. So that's 3 years ago in the US alone. But still,
But still less than I would have thought with the amount we're talking about it today.
100%. That's what was crazy to me. And then I did some more Googling into this. And the reason that I think there's been such a big jump is that it was only labeled or tagged or identified, I don't know what the clinical word is for this, as non-experimental in 2012.
So it was considered like a clinical trial anytime
like-
it was done.
Yeah, or like early stage research.
Well, that just shows you how quickly the technology has advanced.
Totally.
Which is
And the fact that it's
unbelievable.
become such a big part of our conversation, just as women, shows you how much we think about it in the back of our minds and like with our timelines and careers and trying to figure everything out. Just that jump is so crazy in such a short period of time. I think also it's interesting because there's definitely for our generation way less of a stigma towards it of women going in to freeze their eggs because speaking about it with my mom's friends before this, they were a little bit horrified is the wrong word, but their facial reactions were like, what? You would think of freezing your eggs? Just have a baby. And they were like, no. And I do think I looked it up with my uncle as well because we were chatting about it, and the success rates have changed so much. So he did it in 93, 94, 95, around that
Wow.
period. But the success rates were, and I'm going to look this up so I don't get it wrong. Success rates for
Did he have a live birth as a result?
for egg freezing in 1993 to live birth. Let's see. At 12%. Specifically, you had a 12% chance with egg freezing and
Wow.
and
And
going
now
all the way
it's
to live birth.
higher than that?
Now, I will save that for when we get on with Dr. Lucky.
Okay. Yeah, yeah.
But it is crazy looking at how it's changed and the science has progressed over the last few years. So then 2022, the numbers have surged to 29,000. And then in 2023, the cycles increased by 40% and 40,000 women froze their eggs in 2023. So if that's a 40% increase from 2022. And then next one is something I think we all assume, but just to put it down in numbers and to be specific about it, the average age for a first-time birth in the US now sits at 30. So as a society, specifically with the US, we're now having babies at 30.
What would it be? Should I look up what it was in
Yeah.
1985?
Or even 10 years ago, like
Age
90s.
Yeah, the 90s of
Not 10 years
giving
ago. That would make us 10 years old.
birth in 1990. I know. Well, in the USA, in 1990, the average age of mothers at their first birth in the USA was 25.9. So 26
That's
years old.
wild.
A 4-year increase.
So in our for our generation, from our parents' generation to ours, we're 5-year increase.
That's crazy. And just for argument's sake, in 1970, the average age of mothers at their first birth in the US was 21 years.
Oh my God.
So it's
Sometimes I think about that. I'm like, what was I doing at 21? I was getting blackout on the curb of St. Andrews outside of the student union.
and
I
then
should not have been
moving to
giving birth.
Nigeria
And then moving
shortly
to
thereafter.
Nigeria. Yeah.
I know. I think about it now. I mean, I was laughing actually talking about this topic with friends earlier because there's a meme that says, my biggest fear is both getting pregnant and being infertile. And that's
Yes.
like truly, I mean, we're 30, 31, just
Yeah.
married, and I'm getting married, and I feel like I'm a child bride. Like if I were to, I hope one day I am able to get pregnant and have children, of course. But if I were to get pregnant today, I would feel infantile. It's crazy.
No.
At 30.
Well, don't do research on egg freezing and fertility because I literally this morning to Steven, I was like, Steven, buckle up. We're getting pregnant immediately.
We are geriatric.
No, the statistics are crazy. And I was like, I know we don't have jobs, a home, or the visas for us both to live legally in the same country, but we are getting pregnant. He's like, no, we're not.
Line it up. That's the scary thing. And the other thing that Gemma actually was saying earlier was she was like, when we're younger, you're taught, depending on where you live, but you're taught to be on birth control and to avoid getting pregnant at all costs, all the way up to pretty much the age that you're kind of ready to start getting pregnant. And then you're told either you're too old at this stage or it's going to be incredibly hard. So it's kind of like,
it's ridiculous. It's
Yeah,
don't get
what are we
pregnant
supposed to
or you're a
believe?
failure. You're a teen
Yeah.
bride, 16 and pregnant. Don't.
Yeah.
Literally, a TV show was made to scare us from getting pregnant. Thank you,
know.
MTV.
Yeah, truly.
And
Mean Girls,
then
I mean, the age-old quip, you will get pregnant and
yeah,
die.
literally.
Like, that was the
Yes.
discourse.
Yes. And then have a career, become very successful, but also make sure that you're still fertile to have a baby and find
Right.
the perfect partner so that they are a 50-50 parent with you and potentially
Right.
maybe willing to be a stay-at-home dad.
Right. And work long enough so that you have enough saved up so that you have a comfortable buffer so that when you take a step back from work, then you're okay. But also don't take a step back from work because you need to climb the corporate ladder. I know, we can't.
And then also have $40,000 in the bank to freeze your eggs. So
That's what I'm really curious to get into
Yeah.
is average cost because
Yes. I have some of the stats that I read. She can tell me if I'm wrong. For 2 rounds, it can get up to $40,000, which is wild. But on that note, we've had the conversation, which I think is a controversial topic. Is it just becoming a part of a more capitalist money-making society? Because, and this is for 2 reasons. So the egg freezing and embryo banking market is valued at $4.3 billion in 2023 and is projected to double to $9.9 billion by 2032. So in 9 years. But then I did the research on how many women who freeze their eggs actually end up using them. And it's only 12 to 16%.
is that using them in attempt or using them successfully?
An
Like
attempt,
only,
even like pulling them out of cryo, yes, cryo, and using them. And it said the reason why people don't use it is because they get pregnant naturally.
wow. So it really, so to your point, is it just being used as essentially, for many people, this is not the case. And for many people,
No,
it really is a lot like a
100%.
lifeline to a live birth, but is the fear mongering potentially around it just causing people to do it in anticipation of not being able to, and
Totally.
then they're able to. It's complicated.
It's
Because then
really
on the flip
complicated.
side, you hear people where they're like, I had my first at 36 and my second at 38, and and some women have no problems at all. And so is it like, is that the anomaly?
Thing I want to say, which I think is interesting for us, is globally, about 21% of egg freezing is elective, meaning social. So that is like you and me saying, hey, we haven't met our partners yet, or we want to work on our careers. So we are electively choosing to freeze our eggs. So only
Okay.
21% of egg freezing is that case. Most cases, around 69%, serve for medical reasons. Refined by a specific subset, around 10% is undergoing cancer treatment and preservation. So that is
Okay.
something where if you are going through cancer treatment and you haven't had kids or you plan on having kids later, they suggest that you freeze your eggs before treatment
Sure.
because they don't know how the radiation
Sure.
could affect the body and affect your eggs. And so that is interesting that only 21% is people like you and me.
Right. And that's what we hear so often because that's what social media it focuses on. Well, I mean, that really does also shed a light truly on like how incredible of a technology and how incredible science is to
Totally.
enable
And
people to be
provide
able
that
to do that
option.
and provide that option. Did
So
you see
interesting.
that there, I think it was recently in the past couple weeks, they said the oldest baby ever was born from I think I have to get this right, but the egg was from the 90s, but was
Oh,
only
okay. I was
just
like, was the baby born at like 27 months in the womb? Which
the, the oldest
a
baby
one you birth a
ever.
1-year-old.
Science these days. No,
Hashtag
there was an
science.
egg from like the 90s that
Oh,
then
wow.
effectively is what, 30 something years old, but it was only inseminated and conceived or whatever
Um,
recently. So it's technically
oh.
the oldest egg ever. Isn't that crazy?
Okay, but then just to extrapolate that a little bit, I feel like I've used that word more than once in the last 10 minutes. That means that that egg it would have come from someone else because it would have maybe like your parent or
Yeah, I looked it up. It's a
okay.
good question. So the world's quote unquote oldest baby, meaning the baby born from the longest frozen embryo, is Thaddeus Daniel Pierce. Shout out to Thaddeus, who was born on July 26th,
Fab name.
2025,
Yeah.
from an embryo frozen in 1994. This makes the embryo over 30 years old at the time of birth. The embryo was created through in vitro fertilization, IVF, and stored until it was adopted
Uh,
by Lindsay and Tim Pierce. So it was an older embryo
yes.
that then was adopted. That's so
Okay.
crazy. So it's
Yes.
basically a 30-year-old
Person.
baby.
Well,
Shout out to
don't say that.
Thaddeus.
Well, okay, we can't say 30-year-old person because then that goes down into is a cell a human?
Yeah, right. Exactly. Yeah, exactly.
Cut, cut, cut.
Well, I'm very, very, very
Me
excited
too.
to speak to Dr. Lucky. Give us a little background
Let
info,
me
though.
tell you about Dr. Lucky Sekhon.
Thank you.
Yes. Okay, so Dr. Lucky Sekhon is a double board certified OB-GYN and reproductive endocrinologist and infertility specialist practicing at RMA of New York and is on the faculty of the Icahn School of Medicine at Mount Sinai. She is passionate about empowering people by educating them about their reproductive health and options for fertility preservation and family building, and spends time outside of her regular workday to create content, myth bust, and educate about reproductive health on social media and on her blog, theluckyegg.com. Shout out to that because that's how we found Dr. Lucky, and her content is epic. I very much recommend following her. She is an avid clinical researcher who has authored hundreds of scientific abstracts and manuscripts. Most recently, she wrote a comprehensive fertility guidebook, The Lucky Egg, which is coming in January 2026.
Very
Snaps for Dr.
excited for
Lucky.
that.
We're very excited about that. Would have made my research so Streamlined.
I saw a video of her opening the package with her books in print for the first time with her adorable daughters. It was
Oh,
very, very sweet.
sweet. Oh my
Yeah,
God, how exciting to share that with
excited for
them.
her.
Dr. Sekhon's mission is to make fertility knowledge more accessible to everyone so they can make informed decisions about family building now and for their future, which we love.
Which
She's
we
great.
love.
Yeah,
So
we're super excited. Like I said, I feel like I was studying for a test for this because I don't want to mess it up for you all and I want to make sure we ask the right questions. And we're going to kick it off. Very exciting.
Amazing. Let's bring her on. Please note that this pod is for educational purposes only. Nothing we say should be taken as financial, legal, or medical advice. Please do your own research, and when in doubt, ask an actual expert.
I live in Brooklyn. That's where I am right now. I left the office. I figured it would just be easier to do from home.
Nice.
But I'm based in Soho.
But you're originally from Toronto.
Yeah. What about you guys?
Now, I'm from Toronto. Lundie's originally from LA, but we know each other because we both have lived in South Africa for the last 10 years. And so I just moved back to Toronto with my husband, who's South African. But Lundie and I have worked together
Wow.
for 10 years now and went to university
so
together.
cool.
We're a bit of star-crossed lovers
Where did you go to university?
at St. Andrews in Scotland. So we actually have that in common too because you went to university in the UK, right?
Yeah, I went to Royal College of Surgeons in Ireland. I actually had a UK passport before I became a US citizen.
Oh, amazing. And why did you decide to go to university in the UK?
I actually thought that I might want to settle there eventually. Like I don't know, coming from a socialized healthcare system, it just felt more comfortable. It felt less foreign than even moving to the States. That has a very different system. But then I realized like there's a lot of differences there. And I think there's less of a, at least when I was there was less of a traditional path, like less of a, you know exactly what your next step is. It kind of felt like you have to wait for a position to open up. And I'm not that type of person. I was like, I need to know what I'm doing. I need to know like how long my fellowship is going to be. And I just like that predictability. And at the end of the day, I didn't know, like, I went to medical school, I was single, and I was like, maybe I'd meet someone. Like, I was open to settling there, and I love Europe, and it was a great experience to be able to, like, take weekend trips, and as a student, to see a part of the world that I hadn't, previously had a chance to hang out in that much. So it was a great experience, but then I did crave coming back, and then New York was a natural fit for me because my sister, who I'm really close with, lived here. So I used to come back and do rotations at different hospitals and get to know a lot of the doctors here. And it just became a really easy decision.
Yeah.
I just felt like I thought I wanted to do fertility medicine from day one, but I was very realistic that maybe I would discover other subspecialties within women's health. So I kept a very open mind. And I thought, where's better to train than somewhere with a high volume where you're going to see a lot of different types of problems, and you're going to see a lot of them, and you're going to learn from the best. So I really, really loved my training, and I feel like it set me up for success. And now I can't quit New York because I trained at the place that I work at now.
Okay.
And I honestly think as a fertility expert, being somewhere where you know that the lab is really good and you feel really confident in the results it can provide to your patients, it's really hard to say, okay, I'm just going to start over fresh with someone else. So I have no family here, but I'm really committed to my job. And I think where I work is fantastic, and it would be very hard for me to leave.
Well, I realized we just jumped straight into it and then went straight into background. First, thank you so much. We are so thrilled to have you on. To be fully transparent, this is our second recording of the podcast.
Yay.
We had sat at all these tables with all of our girlfriends talking about all these topics that we feel like we should know, but we don't know enough on. And so egg freezing was such a big topic of it. So we're super excited about this. Lundie and I have decided to split this up where I will be running most of the questions in the interview, and Lundie is coming in blind as if she's the listener who will ask the clarification questions if we get a little bit into details or there's an acronym we use that isn't clear. She's going to come in with her listener mindset on and be like, okay, wait, we need to break this down.
That's really smart. It's like when I had my husband proofread every chapter of my book. He's a lay person. He doesn't say that he is, but he is. He's done medical. He doesn't have a medical background. But if he didn't understand it, I was like, oh, I get so frustrated. But then I'd be like, well, if he doesn't understand it, the reader's not going to understand it. So it's actually a really good system.
That's true.
And
It's
I
true.
do have
Okay.
to say, although I didn't do any of the research for the podcast, I was listening to a couple of the clips from previous ones you've done, like with the Betches cast with Jordana. And you mentioned that if you were not a fertility doctor, one of your dream jobs would be a Real Housewife of New York. And I was like, we're going to
Yeah.
get along great. I was like,
Yeah.
perfect. I was like, you're already in. So, yes, I haven't done much of the technical research, but I am already a fan. So thanks for being here.
Oh my God. I'm so glad you brought that up. I don't mean to keep going on tangents, but
No, I think that
since that podcast, the Real Housewives of New York actually played an integral role in me writing this book.
Oh my God,
It sounds
amazing.
like such a, I know it's like such a, like, how do you get from one point A to point B? But I had a patient that now has become a dear friend of mine, and she had already frozen eggs elsewhere. So like we had gotten through the technical talk very early in the conversation, and she was just such a delight to talk to. And we were just, shooting the shit. And I happened to divulge to her because we were talking about Bravo, as one does. And I was like, they actually approached me, and it somehow came to fruition that I was getting interviewed as like, I'm sure they interviewed like 100 or 200 women in the New York City area, but they were like, oh, it could be interesting to have a doctor. And I was like, oh my God, I don't know what I'm doing,
happening.
why I'm entertaining this. She was like, why the hell would you ever do that? And I said to her, because I feel like automatically it makes your platform so big. And then it had opened doors. And if I want to, write a book, and she's like, do you want to write a book? And I was like, yeah, that's kind of my dream. And this is a convoluted way to get there. And she was like, she just kept it to herself. And then like many months later, she connected me with someone that she knew who was going through infertility themselves, who's a major book agent. And she was like, I can't find a single book. And so that's how this connection happened. Isn't that
I
so
love it.
funny?
That's
incredible.
amazing. That's
Yeah.
amazing. Lundie has the best thing for this. So she is both of us are, but even more, Lundie takes it to the next level of loving reality TV. But she
Yeah.
calls it NTTV, so non-triggering TV. And I completely subscribe to that.
Yeah. It's also like a study of anthropology.
Totally.
Yeah.
Yes.
Yeah.
Yeah.
Too
You
much
learn a
triggering
lot.
stuff going on. So anyway, I'll just say that's my context with you thus far, but I know it's going to be a great conversation. So thanks again.
Awesome. So we spoke just briefly about the book. Book is coming out. That's very exciting. January 2026. And what is your target market for this?
Well, the purpose is that I have conversations day in, day out with patients who are coming to me for advice. And I don't mean this in a negative way. It's just the reality. It's shocking how little people know. As you mentioned, when you were describing your podcast, everyone feels like they should be an actual expert on their body, especially something that happens for a lot of people each month in the background, ovulation. But even that simple fact, people often get wrong, and they don't know how to track their cycles. And I think it's just a very unique problem to women, and it affects men as well. But I think it's really hard for us because you grow up and the first half of your life and adulthood is avoiding pregnancy, and that's what you're taught and that's what you emphasize. And then all of a sudden you're expected to just magically do this 180 one day and start caring about how to track ovulation and how to figure it all out. And so most people are left to their own devices. There is no formalized process to educate 20-something, 30-something-year-old women. And it's kind of like, well, what shows up in their TikTok algorithm? And, do they happen to have a great OB-GYN that has a lot of time on their hands? Most people don't, because of the way our healthcare system is set up. It can be very hard, in those regular annual visits to get all the education that you need and that you should have. And fertility is such a time-sensitive thing. So people are aware of that, but they don't know everything there is to know about their biological clock and what they should be thinking about, things that they should be maybe testing from the outset, depending on their personal or family history. And so it's like the lack of knowledge and guidance combined with this feeling of like a pressure cooker, like, oh my gosh, the timer's on, leads to this really unhealthy environment where women are kind of desperately searching for answers, and it's kind of like a matter of luck. So the reason I wrote this book is because in the course of treating patients and recognizing that this is a growing problem and getting frustrated for my patients and frustrated as a doctor, I also grew frustrated with the fact that it's been several years with no movement in the space of books that can actually provide people with the information and decode all of the acronyms and explain, this really intricate process of fertility testing and treatment. And this isn't just a book for people that are facing, some sort of struggle with their fertility. It's for everyone. So it's kind of like health class 2.0. Here's what you need to know, whether you're thinking about maybe freezing eggs for the future, or you just want to understand what your periods mean and what you should be thinking about as you start gearing up towards being ready to start trying, when to seek help, how to find a good clinic, because that information isn't anywhere. Women need an insider to be like, hey, this is what makes a good clinic. This is maybe not as optimal. Here are the questions to ask. And I'm sure I'll probably get a lot of heat for it because, not all clinics are created equal. And I think it's important to have those uncomfortable conversations. They're inconvenient truths. And, it's everyone would like to think that every clinic is the same, every doctor is the same, everyone's providing the standard of care, but we know that's not true. And so this is to level the playing field and say, I'm bringing everyone up to speed. And then it gets into the very difficult conversations near the tail end of the book. There's a section on troubleshooting, like what are the different pitfalls throughout every step of the IVF process? Is it not getting enough eggs or not having enough eggs fertilized or not making enough embryos? And what can you actually do about it? And what can you not do about it? And just being really honest and making it really accessible and easy to understand.
Amazing. I think you said 3 things there that feels so truthful for us and this topic today and our conversation today, but just as a whole of what we're trying to do is searching for answers, decoding, and then insider advice. And I think having that egg and having that on your bedside table is so, so helpful and so important. So I'm very excited to read it and to get into it, but also to get into some of the details today and specifically around decoding too and kind of breaking this down of what does egg freezing even mean? The topic of the episode, what the fuck is egg freezing? So you're OB-GYN and an REI. What is an OB-GYN and what is an REI and what is the difference?
Yeah, so 7 years of training in total. Basically, after graduating medical school, it's 4 years of OB-GYN residency in Canada. It's, I think, still 5 years. And that's where you learn how to just, at the most basic level, do OB and GYN. So we're delivering babies. We're learning urogynecology about the pelvic floor. We're learning about GYN cancers, high-risk pregnancies. It's like everything. And it's so much that people have actually said in recent years that it should really be broken up into 2 different specialties because you're biting off way more than you can chew. It's how I felt when I started writing my book. And then once you master all of that, then there are these subspecialties that you can really delve deeper in. And that was 3 years of fellowship for reproductive endocrinology and infertility. And that is the study of hormones, understanding where they come from, what can go wrong, how to diagnose it, how to troubleshoot. It's also infertility. My area of expertise is to know how to stimulate a woman's ovaries, know how to help them ovulate regularly if that's an issue for them, know how to diagnose any sort of complex things that could be getting in the way of a pregnancy forming. But also I'm working intricately with a team of embryologists, which are like the unsung heroes behind the curtain. No one really thinks about them or talks about them. But they're the people that are actually injecting, sperm into the eggs or freezing the eggs physically. And these are really highly specialized procedures. And there's a very rigorous training process. So it's like a beautiful dance between what we do and what the lab does. And it's just like knowing how to guide the clinical management and knowing how to come up with the best plan. That's really my job.
And is every OB-GYN an REI?
No.
So you go down a specific path focused on fertility, and REI is the fertility path.
Yes, exactly. And I don't even want to say every women's health expert is an OB-GYN because there's a lot of people with women's health expert in their bio, but they're not the actual experts. But REI means you went deeper. And so you can't become an REI without having done OB-GYN first. That's like the general basic training. And then on top of that, you have your subspecialty training. And this is like 3 years of intense research and clinical training in fertility specifically.
Okay. So then if we're looking at fertility as a whole right now, it feels like we keep hearing from the broader ethosphere that we are a less fertile generation. Based on your experience in the science, is that true? Or is it that we're having babies later and fertility is then decreasing because of us having babies at 30 instead of 25?
I think that's the main factor. But we can't ignore that our environment has changed, our exposure, our cumulative exposure in our childhood till now to forever chemicals, plastics and things like that. It's different than what it was for our grandparents, for sure,
Totally.
So it's hard. It's like the needle's always moving and you can't really study a certain population in isolation because it's so much of our environment and what we're exposed to is different. Also, the rise of obesity, right? The rise of obesity and insulin resistance, which is a metabolic imbalance that can greatly impact your fertility in so many different ways. It can change the environment of the ovaries where eggs are being matured, and it can alter their quality. But it can also make the lining of your uterus less receptive to an implanting embryo. So I think in general, the accumulation of health issues over time, a lot of which is related to obesity, and then a lot of it's also related to being older when we're trying. We know that there's a biological clock. We're born with all the eggs that we're ever going to have. And over time, we lose those eggs and we don't have the ability to make new machinery, right? And men are making new sperm all the time. So their filing cabinet, everything is intact, and for them, it's not completely, they're not immune to the effects of aging, but it's different for women, right? Our ability to ovulate a healthy egg that turns into a healthy embryo that can then implant and stay implanted is really impacted by age. And so for a lot of us, it's like, it seems so normal and commonplace to be like, yeah, I'm in my mid to late 30s and I'm starting to try to build my family, or I'm trying for baby number 2. I mean, so many professional women are waiting, because it's just like, you can't do all the things all at once. And so it just puts you in a situation where there's a higher inherent risk of it taking longer to get pregnant and a higher risk of miscarriage if a pregnancy occurs. And it's not like a cliff. So it's not like you turn 35 and everything is all bad. But certainly the odds start to flip in favor of it taking longer and there being a much higher risk of miscarriage, especially as we hit like 37, 38 and older. But interestingly, as we get to the extremes of age for advanced paternal age, which is like, people argue, is it 40, is it 45? But particularly as men can father children in their 50s and 60s, they're accumulating mutations that can be passed on. So we know there are certain health risks for children coming from much older fathers.
So many things we could go into. Quick question around the environmental factors. Is there any truth to the myth or the potential myth that birth control or using birth control for an extended period of time affects your fertility? I feel like we're told that.
Yeah, that is a myth. That's not. In fact, I would go as far to say that if anything, it's probably protective against a lot of things that can impact fertility. For example, there are 2 really common conditions that are super prevalent. 10% of the population has PCOS, polycystic ovary syndrome, and 10% of the population is thought to have endometriosis. So the pill can help to correct hormonal imbalances and to suppress the process that feeds endometriosis and causes painful periods. So you could be unknowingly just treating these issues and suppressing them and kind of correcting imbalances, because with PCOS, you can have this overdrive of testosterone. And one of the things that the pill can do, estrogen-containing birth control, actually induces the formation of this protein called sex hormone binding globulin. And it's basically like a sponge that goes into your blood and like soaks up all the extra testosterone that's causing a lot of the bothersome side effects. You're kind of protecting yourself by being on the pill all those years. So people should not be afraid of the pill. It's not causing infertility. It's not going to prevent you from ovulating in the future. It's just preventing you, if you're taking the pill, from ovulating now to avoid an unplanned pregnancy.
And to be clear, that's all types of birth control. So IUD.
Yeah. IUD, there's 2 different types. There's hormonal and non-hormonal. The hormonal type typically can stop you from getting a period altogether or cause your periods to become really light, but these are temporary and reversible effects. So there is really no form of birth control that's going to cause permanent infertility unless you want it to, like removing your fallopian tubes.
Okay, yes. That's
Myth
clear.
busted. Okay, thank you. Glad
That's
you cleared
where
that up.
we got into it a little bit into there. We mentioned the word freezing. We were hoping that you could take us through a step-by-step process of what it means to freeze your eggs.
Sure.
We put it out to our friends, and I had a friend who sent a 9-minute voice note back in about her experience freezing her eggs and just saying that it was a lot harder than she expected. She had PCOS, which you're speaking about, and she felt that she wasn't really prepared by her doctor for the effects that it was going to have on her, both emotionally and physically, and especially post-op. So that's where we wanted to talk to you about, to not sugarcoat anything for us and tell us what it's going to mean if we were to come to you and say, hey, we want to test for fertility, freeze our eggs. What does that process look like? And then what are the effects we're going to potentially feel from it?
Yeah, for sure. Well, the whole purpose of egg freezing is to salvage whatever eggs we can get to in a given cycle, and freeze them for future use. If and should you ever run into fertility issues, it could be coming from the male side, the female side, or a combination of both factors. Any reason that you could need to do IVF, how wonderful would it be to have a larger pool of eggs stashed away that have a better quality to them and a higher conversion rate from eggs to healthy embryos because they were captured at a younger time in a different environment that was less prone to those errors that I was referring to earlier. And so something that everyone needs to understand before we can even talk about egg freezing is something that's happening in the background of our bodies and our ovaries all the time, whether you're on the pill, off the pill, pregnant or not, whether you're actually ovulating or not. You're born with a stockpile of 1 to 2 million eggs. And by the time we get into menopause, which is typically our early 50s, that's when you've fallen below a critical threshold of, let's say, about less than 1,000 eggs. And that is like falling below the bottom of the barrel. You stop being able to release eggs, right? And so basically, if I scan any woman off the street and I do an ultrasound on them, I'm expecting to see a certain number of eggs available at the surface of the ovaries, and they are depicted as these black circles that look like bubbles of fluid because that's what they are. They're called follicles. Each one contains 1 egg. When I look at someone's ovaries at any snapshot in time, I'm not looking at all of their eggs. I just told you it goes from like 1 to 2 million to less than 1,000. I'm seeing normal numbers that are easy to count, like 10, 15, 20, depending on the person. What I'm actually looking at is a very limited subset of the total number of eggs that are in the stockpile that they were born with. I always use this analogy of like a pantry and kitchen cabinets. The pantry is locked. I don't know how to get the lock open, and neither do you. But every month, somehow that door flings open and a few of those eggs are able to be removed, and they're kind of rationed. So the more you have in your pantry at that snapshot, the more you bring out, and they move to the kitchen cabinet. That's what I'm seeing in the ovaries when I scan someone. And so I can kind of get a general sense of what's in the pantry of the stockpile by just seeing like, okay, this person's 35 and they have 15, 7 on one side, 8 on the other. It kind of gives me a general gauge that this is average for age. Now, what your body's doing naturally when you ovulate is you're sending a signal to the ovary from your brain, and it's almost like you're opening one cabinet or the other, and you're only able to remove 1 egg, and the rest of them are shut away in the cabinet, and they're perishable. They go away, they degenerate, and the cabinet gets cleaned out. And then a new set come out from the pantry each month. So you're only able to access 1. What I have the tools to do is I can have you take shots for 8 to 10 days. And what I'm doing is I'm accessing and maturing all of those eggs in both cabinets and opening both cabinets and taking out everything that I can before it goes to wasting as perishable. And I'm putting them in the freezer, so they're not changing over time. And so that's what egg freezing is. And the reason I describe it this way is because a lot of people are concerned that this is going to impact their fertility. It's going to put them in menopause. And it makes sense that they would think that, okay, you're going into the stockpile, but I'm not. I wish I knew how to go into the stockpile, because then it'd be easy for me to tell everyone, okay, you're 30, I'm going to freeze 20 of your eggs, but I'm limited to working with what your body makes available. Yeah. And that's going to be a function of things like age, because over time we don't make new eggs and our stockpile gets smaller. But everyone loses eggs at a different rate. And sometimes it's like something that happened in your life. It could be an infection, an autoimmune thing, something environmental, or it could be even just genetic, that some people lose eggs at a faster rate starting at an earlier age. And so whatever snapshot I meet someone in, I count the number of eggs on the scan, and I'm like, okay, this gives me a gauge that if I see 20, I'm hoping to get 20. Maybe you won't respond 100% and we'll get 15. Maybe you'll over-respond and I'm not seeing every little follicle and we'll get 25. So it gives me a general sense, a range of what I could expect and what I'm shooting for and how much medication to give someone to access those eggs that are in the kitchen cabinets, right? So the first step is
the amount of medication you're given is dependent on how many eggs you see when you do that initial scan.
Absolutely. Yeah.
Really
Again, it's part of the art of what I do as a reproductive endocrinologist is you learn how to stimulate someone's ovaries. That's why I think going to someone that does a lot is helpful, because they've seen it all. They've seen people's ovaries behave in different ways, and someone with PCOS typically will have a much more robust response. So they're going to have a harder time recovering. And I always tell my patients who have a really high egg count, this is great. I have access to all these eggs, but you probably are someone that wants to mentally prepare, not just to take the day of the egg retrieval procedure off, but even the day after, because you're going to feel bloated. You're not going to feel as great as the average person. I have a very low egg count. So when I went through IVF, I was like, I feel great. I feel nothing. Maybe it would have been better if I did feel something, because it would have meant I got more eggs at retrieval. But it's all kind of individual, it's person to person. When you're taking the shots, these are in the lower abdomen. Usually you're pinching an area of fat and you're going very superficially with a thin, small caliber needle. And you're injecting those same hormone signals that your brain sends to just mature and ovulate one egg. And you're also taking hormones, or you're taking hormone blockers to prevent your body's natural urge to want to release a second hormone signal to make you release the eggs, because that's what your body knows how to do. So we're trapping them, growing them, trying to get them to grow together as much as we can. And you're coming in during that 8 to 10 days of shots for very frequent monitoring, so we can kind of titrate. Do I want to add or cut back the medication? And at what point do I feel like your body's ready? Similar to when women go into labor, and that's, when their body's ready to have the baby. We do egg retrieval 7 days a week because, if it needs to be done on a Sunday, I don't want to push too far and overcook the egg, so to speak. And I don't want to trigger too early. The trigger shot is the final shot you take before the egg retrieval, because then you won't get enough mature eggs. So what's my job is to figure out this first part and get it right the first time.
I didn't realize how case by case it was. I thought that there was maybe a 7-day cycle and everyone got the same injection and dose of drugs. And then on day 7, you come in. And so it's really interesting to hear how individual it is and personalized. I guess that's
Yes. And it's funny because I talk to patients all the time and they'll say, I really want to make sure that this is individualized. And I always say it totally is. There's only one way to do it, and it's to tailor it according to your response. There's different protocols, there's different dosages you can start at, and you're always making adjustments along the way. But the biggest decision I make is, when are we ready to call it and say, okay, we've gotten as many of them to grow and this is the optimal time. Take your final injection tonight. That is the one really time-sensitive injection, because usually we time it like 36 hours before the egg retrieval. And then you come in 2 days later in the morning, check in for your procedure. You're fasting, for at least 8 to 10 hours, depending on what the anesthesiologist at the center that you're doing this at want you to do. But you're going to be put to sleep. And the sedation is IV. You're sleeping, you don't feel anything, you don't remember anything. Now, this might not be standard across the board, but I think most centers in the United States do use anesthesia. But this is a question to ask at your first consult, right? But where I work, we put patients to sleep. They're breathing on their own. This is not like a big surgery where they're intubated, but they are sedated and they're watched by an anesthesiologist the whole time. And they're monitoring your vital signs. And what we're doing down below is everything is done vaginally. And all we're doing is an ultrasound. And you might have seen like one of those vaginal ultrasounds. It's like a wand. It's like all handle. I always tell patients it's only going to go in like this much. But basically there's a needle mounted onto it. It almost feels like you're playing pool with like one of those devices where you can't get to the pool balls in the corner of the pool table. I sound probably like a fool because I haven't played pool in a long time.
I can picture it.
But it feels very much like that, because you're kind of centering yourself with the ultrasound and you're using the needle and you're watching on the screen, and under ultrasound guidance, we're going through the vaginal wall with a needle into the adjacent ovary and draining each bubble of fluid, hoping to pick up the egg that each bubble contains. And then we're doing that on one side and then that on the other side. It literally takes anywhere from 5 to 10 minutes. You wake up in the recovery room, shocked that it's over, and then someone has to pick you up that day because of the anesthesia. You might feel groggy and out of it. But we'll tell you, this is how many eggs we got. The next day we call and we're like, this is how many were actually frozen. I don't expect 100% of eggs to be mature, but they need to be at the right stage of development so that they're capable of being fertilized by sperm one day. And only the mature ones are the ones that really freeze well. So we'll let them mature in the lab if they come out immature. So the next day we'll say, okay, this is how many we got. And if 80 to 90% of what we got out ends up being mature and able to be frozen, I'm usually very happy with that outcome. And I always talk to patients afterwards about what did we expect based on your baseline egg count? And, if I expected or hoped for 20 and we got 17 at retrieval and then 15 were mature, that is a great outcome, right? So I think it's important to have realistic expectations. And then the final big question is, how many do you need to feel confident? Because remember what I said about ovulating an egg, and not every egg will fertilize, grow into an embryo. Not every embryo is going to be healthy depending on the age of the egg. that all plays out. Just because you do egg freezing and it feels like you're doing this high-tech thing, that inefficiency of human reproduction doesn't magically go away. So you really need to talk to your doctor about their experience with thawing eggs from women of varying ages and what we think is a safe number for you to bet on.
And what would you say is that? So if you're targeting a specific number, how do you calculate that? And what is the number of people?
Well, I look at our success rates. I look at our typical thaw survival. Like this isn't theory anymore. Every week I have patients that are thawing their eggs and I'm seeing in real time what the results are. And so it can vary from person to person. It's a small sample size, but when you look at the population-based data, our thaw survival rates are really high, like 90% or so. And then, 70 to 80% of eggs will fertilize. And then about 60% of those that fertilize will go on to make an embryo. And then depending on your age, the age of the eggs, right, when you froze your eggs, that's going to dictate the odds of a given embryo that forms from those eggs being healthy or not. So let's say you're 35 and you have 15 eggs thawed, okay? Maybe 13 will survive the thaw, 10 fertilize, 6 turn into embryos. Based on being 35, I'm expecting 30 to 35% of embryos to be abnormal, 2/3 of them will be normal. So maybe 4 out of 6 normal embryos. And I usually say, I would like you to be in a position where you have 2 healthy, genetically tested normal embryos per goal child, because each one has individually a 60 to 70% chance of live birth. Now, these numbers might be an overcall or an undercall at different labs, but I think you have to ask your doctor about their experience because everyone's success rates can be slightly different. I think if you look at success rates of different centers within the same population being treated, I think you will still see differences, and a lot of that comes down to lab quality.
Got it. So lab quality being where the egg turns into an embryo and then comes back to you?
I think where you freeze matters too, right? Because remember, that's the earliest exposure for the egg. And also how your ovaries were stimulated can make a difference. I mean, there's age and then there's all these other external things that can have an influence that you have to care about.
Definitely. I want to get to age in a second, but I just have a quick question. You mentioned where you freeze. That's something we would never think about going into asking about. So if someone comes to their OB-GYN or their fertility specialist that they're going to, what questions do you recommend they ask about where their eggs are being frozen? And do you recommend people to go to the same clinic for freezing and then insemination, if that's the right term I should be using?
Yeah, I think that anyone that's thinking about freezing their eggs, the best place to do it is a place that you would choose to do your IVF at.
Okay.
So IVF success rates, you can extrapolate from that. Where is the best place to freeze your eggs? Because it's telling you something about the quality of the lab and the excellence in how the procedures are carried out. The quality control is so important. And I think volume plays a huge role in this, right? Like this is like one of many examples of the truth bombs that I drop in my book. Cause like that could be a very polarizing thing for me to say. But it's just the truth. Like if you were going to have a surgery, would you want to go to the guy that does 20 a year or 1,000 a year?
Yeah.
It's a no-brainer. Anything when it comes to procedures, any sort of technical thing, you always want to go where they have better experience. It's a well-oiled machine and the processes are honed. And so I think if you wouldn't go somewhere for your IVF because you've heard certain things or the success rates look low, then don't go there for your egg freezing. Bottom line. And I personally wouldn't freeze my eggs anywhere that doesn't have outcome data on IVF.
Okay.
Ask for the outcome data.
And the outcome data, does that include the success of the lab where it's frozen? It's kind of tied all together for that clinic?
It's hard to tease apart, right? And I've had patients transfer eggs from other places that they froze their eggs at. Some clinics won't accept transfer. So don't always assume if you freeze one place, you can just easily move them around because the receiving clinic has to say, yes, we accept. And actually, anytime we have eggs transferred from one clinic to ours, we have to go through a review process. And sometimes if it's a clinic we're not familiar with, we'll discuss it as a group. We need to be comfortable with, the way that the lab where the eggs were frozen does things, the way things are labeled. There's a lot of technical behind the scenes things that we care about that aren't immediately apparent to the patient.
You also mentioned some environmental factors that obviously impact the viability of the egg and then the embryo. What would you say is in the control of the patient or the woman leading up to that process? Are there certain things that you say that they should do within their control in terms of diet or lifestyle leading up to a freezing round?
Yeah. Yeah. And I think that there's a fine line between trying to control the things we can control and driving oneself crazy, or implying that everything is within someone's control and then people feeling like the blame is on them for an outcome that was, not what they had hoped for. And I want to be really clear in saying, like, there's a lot of this that you cannot control, but think about your ovaries as the place where all this is happening, right? Like when you're taking the shots, we're trying to mature the eggs. They're getting pushed through the 3 main stages of development. And those are actually critical points where, like, the filing cabinet is doing its job. But we know that toxic exposures like cigarette smoking is not great for egg quality. It's not great for implantation of an embryo either. Excess drinking, so we define that based on looking at patterns in certain studies as more than 4 drinks consistently in a given week. That's actually not that hard to exceed. And so if that's something that people are doing a lot of, in the lead up, that's not creating the healthiest environment. And it's also not creating the healthiest environment for your body to metabolize and break down the medication. Think about what actually allows you to respond to a hormone or a drug. Your kidney and your liver break down these drugs, and then the drug carries out its function, but it has to be metabolized and broken down. And so if your organs are not optimally functioning because they're basically being poisoned and they're distracted and needing to detoxify the body of all these other substances, you're not putting your best foot forward to respond as well as you could to these medications. Excess weight is a big problem. We know that women who carry a lot of excess weight and their BMI is really high, and a lot of times it's not something because they're just not doing all the things they need to be doing. Sometimes it's genetic, it's metabolic, it's how your body's wired, and it's not fair. But it can create a situation where you're prone to responding in a lower way. So it's all important. Lifestyle does matter. Controlling chronic medical conditions so that your body can function in an optimal way, and creating the healthiest environment. Always think about what could you be doing to create a healthier environment within your ovaries. And it's not going to be taking a magic pill you bought on Amazon. It's going to be the common sense things that a cardiologist would tell you about taking good care of your heart health. Anything better for heart health is going to be better for fertility. And, an antioxidant rich diet is also a number one thing where it's, low in processed foods and really focusing on healthy fats, having lean protein and having lots of fruits and vegetables. It's common sense and it's boring, but it's the answer.
Yeah, it makes sense. And it brings us down to kind of success rates too. And you spoke about age quite a lot through this. Can you help us break it down around where you suggest people start thinking about their eggs and freezing their eggs, what age you suggest, but then the reality is so many of us only start thinking about freezing your eggs when you're panicking because you maybe haven't found your partner, or like you said, you're waiting because of your career. So how are they impacted based on your age?
Yeah. Well, age affects 2 things: how many eggs are available and being recruited into the kitchen cabinet, right? How many can I get to? And that can be different for different people. But in general, the pattern is we don't make more eggs as we get older. And so you're typically going to have fewer available for me to work with in one round of effort. So the efficiency can be affected by age. And that's at least something that I can test on a person as an individual, where I can actually, the patient can walk out of the consult and I'm not like, these are the stats. I'm like, no, this is how many I saw on your scan. So it gives me a rough indicator for your individual situation that this is how many I could have access to. That's helpful. We can also test something called your AMH level, which is a hormone test that tells us more or less the same thing. It's a quantitative marker. Numbers above 1, 1.5 are considered normal, but it's all relative. And I actually, on my blog called theluckyegg.com, you can go on there and there's an AMH calculator and you can put in your age and your AMH level, and it will plot you on a graph with 17,000 data points. That is from an actual study that looked at women presenting to a fertility clinic for a variety of reasons that did their AMHs. And so you can kind of see where you fall. Does it really matter where you fall relative to other women your age? It kind of doesn't, but I feel like it helps put it into context because people are like, what am I supposed to think about this number, right? And there's no test for egg quality but we're always aware that the ability to ovulate an egg or have eggs retrieved that can turn into healthy embryos really starts to change, especially over 35. It's never perfect for anyone. In your 20s, even then, 20 to 25% of embryos coming from your eggs could have these typos or errors that wouldn't allow an embryo to implant, or if an embryo implanted, it could result in a first trimester miscarriage. Anyone can have a miscarriage. Anyone can have these typos or errors, but they become far more prevalent as we get older. So at 37, 38, 50-50 chance of an embryo having these typos. And at 40, it's 70% will and 30% won't. So it starts to become harder to just randomly ovulate that egg that you need. Does that make sense?
It does, yeah. So if we're looking at someone who comes in at 35, what is their likelihood at 35 to have a successful to embryo than to live birth?
It depends on how many. So I think the better way to think about the question is, how many do you need to feel confident? And I think our confidence is really high when someone's freezing their eggs in their 20s and early 30s. Like in your 20s, even 10 eggs frozen could be really helpful. You know, most of our egg donors are in their 20s because we see that you only really need like 6 to 8 usually to start with to get to a live birth. So it's a much higher conversion rate. So even 10 could be really high yield. And your early 30s, I'm like, okay, over 10, you know, closer to 15 is great. We always say at the very best, it's like a 10-to-1 ratio from eggs to live birth. That's the reality of human reproduction and how inefficient it is. At 35, I'm like, at 35, I want at least 20 because I want wiggle room in case you need multiple embryos and in case you want to have more than one child. At 38, it becomes harder to know how many. I'd say like 25 to 30. But studies have shown the success of egg freezing really does start to drop off beyond 38. I've had patients who've had success when they froze eggs at 38 and even at 40. But it becomes much harder to calculate because you're on a part of the curve that's moving more rapidly. If for some reason we didn't end up having what we needed, we could try to do more rounds at that point. If you're at an age where it's really difficult, there are other avenues. We can think about things like donor egg, but we can use your partner's sperm and you can carry the pregnancy. So these are not easy conversations, and it always feels like you have to compromise to some degree. But that's not to say it can't be successful. It's just really important to be realistic about when things become a bit foggier in terms of being able to predict outcomes.
Interesting you say that because Caitlin and I actually share an OB-GYN here in Cape Town who we love. She's great. But when I spoke to her about my fertility several years ago now, I was like, everyone's testing their fertility. In the US, you can send like a swab of your saliva somewhere and they're telling you what your fertility is. Should I be thinking about this? And her opinion was that until I was ready to start having kids, to essentially not worry about it. She was like, I feel like there's a lot of fear mongering around this.
Yeah.
If I test your fertility today, it could look different in 6 months when you're ready or a year when you're ready. So basically don't worry about it until you're ready to start. And then if there's a problem, we'll address it. So what I hear you saying is that there's a lot more of a proactive stance that people can take to really, you know,
but
have
I don't
a better
think she's
chance.
wrong. Here's the confusing part. I don't think she's wrong because there is no such thing as a fertility test. A fertility test is trying and seeing if it works out, right? Unless I agree that you don't need to do every test under the sun right now, because if you find that your tubes aren't blocked or your partner has sperm now, but you're going to start trying in 4 years, maybe what you find out now won't be relevant.
Right.
However, if something is non-invasive, relatively cheap, and it could change and you know what you would do and it might provide you with actionable information, I disagree with the bury your head in the sand approach. So I'm kind of like in between. I'm not like, oh my God, everyone should be freaking out and test all the things, because there is only so many tests that are actually relevant. But I do think even if you weren't trying to get pregnant or even considering egg freezing, getting a spot check, like an ultrasound, I think is never a bad idea. I think all too often this is something that falls to the wayside, and I'm the one doing the scan on someone for the first time in their late 30s and telling them, hey, you have a huge fibroid, you know? And I'm not saying that doing one scan in their late 20s or early 30s would have picked up anything. Things grow over time. But I do think like you can get a lot of valuable information from a simple baseline ultrasound, a pelvic ultrasound, and that's not health guidelines. This is my professional opinion that I think it could be beneficial and something I would tell my daughters to do one day when they're old enough. I think getting an AMH checked, who cares? It's a blood test. As long as you don't freak out if it's low and your doctor can explain and put it into context that this doesn't mean anything about your fertility. If you're ovulating every month, it means you have enough eggs to ovulate. and everyone's
Right.
on a level playing field and ovulates only one egg each cycle. So whether your egg count is high or low matters not at all for fertility. It only tells me how good of a candidate you are for egg freezing, how many eggs I can get to, what's in the kitchen cabinet, but everyone is only bringing out one each month, right? So she's not wrong, but I also don't
Right.
I think that there's too many extreme views. I feel like you can test things, just don't freak out at the result and make sure you have the right information about how to interpret the result and what it all means.
Totally. And knowledge is power. That's a
I'd
big
rather
part of
find out
why
if
we're
I had a
doing this
really low
podcast.
egg count, right? It
Totally.
might prompt you to do egg freezing and it might be easier to get the goal number needed because when you're younger, you don't need as many because they should be better quality.
100%. I completely agree. Okay, I know we're running out of time, so I want to stop us there unless, Lundie, you have another question.
No, although we could go all day, truly,
I know.
honestly.
We had
This
a
is
lot
Do
of
part two.
I know. Honestly, we need a
Please.
part 2 because we had a lot of questions around your opinions on things, and that
Yeah.
was outside the process. Like, do you think there's fear mongering that's happening out there? But I wanted us to be really specific about the facts around it and get to those
Yeah.
because those were the questions we got. But I think there's so much more we could do. So if you're open to a part 2, we would love to do a part 2 around the
100%.
like industry as a whole.
Yeah, we could definitely do a part 2 because it's just like so
Okay.
much to cover.
There's
I have
so
my kids
much.
locked out of my house, so I will have to go. But
100%. Thank you so much again for joining us today. We were so fortunate that you said yes, and we can't wait for part 2.
sounds great.
Thank
Thanks.
you
It was so nice to
so
meet you
much for your time.
guys. I'm excited to
So
see how it
nice
all
to
turns
meet you.
out.
You
Thank
too.
you so
Amazing.
much. We'll
Thanks
chat
so much.
later.
Welcome to the Debrief, where we discuss things we needed a little more clarity on.
Well, before we get started, it's very important for me to circle back on a topic that we touched on in the intro, which is Taylor Swift's next album.
Yes.
I
Yes,
just
let's hear it.
finished the podcast that she was on
Yeah.
with Jason and Travis, and it's just so cute. She's so happy, and she just loves him. And the album comes out October 3rd.
Oh, yay.
Already on my
Okay.
calendar. Very
I'm
exciting.
as happy for you as I am for her.
Thank you.
Yes.
Thank you. Okay, but back to the topic at hand. Egg freezing.
Egg
Dr. Lucky.
freezing. What a whirlwind episode. That was very fun.
Very fun. She's incredible. Obviously, so inspiring and well informed. And I love the amount of content that she's making to make it easier for women to learn more about the process. I think there's just so much. Like we hardly
much.
scrape the surface.
We
and so I
really
think-
overpacked what we thought we were going to be able to talk about. We were like, we're
Caitlin
going to
had
talk about
like a
egg freezing.
50 question
Yeah. I'm
prep
like,
guide.
I have 35 questions to get through. And I was like, okay, probably 2 minutes a question. It's an hour episode. This is going to go great. And I think we got through 10 questions, but it was good because we went in depth into those specific questions. And I realized we spoke about egg freezing. We didn't touch on IVF. We didn't touch on the market or the business and the industry as a whole. And we really didn't also talk about we talked about side effects, but not deeply into emotional side effects and the emotions of freezing your egg, which I still think is an important topic. But we did talk to her about doing a part 2. So hopefully we will get there eventually. But we are here to talk about what we did talk about and do a bit of debrief on that because both Lundie and I have lots of questions,
Got some
lots of
questions, yeah.
follow-ups.
A couple other things. So I kind of also noted down things that were particularly surprising. First being that it's easier for men, of course, to continue having children their entire lives because they're making new sperm all the time, whereas women are born with all the eggs we'll ever have. We're not producing new eggs. Every time we ovulate, we're releasing an egg from the finite supply, thank you, that we have. So we hear all the time, obviously men can continue to have children most of their lives. Dr. Lucky did say that the later or the older men get, the more likely they are to have issues. So that is similar in that sense. But I didn't know that scientifically, or I suppose I just didn't put it together, that scientifically it's because they are generating new sperm every time that they ejaculate, and we only release one egg.
Okay, wait. They are not generating new sperm every time they ejaculate. They're generating new sperm into their testes, and it's stored there, and then they ejaculate. It's not like create, ejaculate.
Fact check.
Systems
Thank
go.
you. Yeah, literally load it up. Fair enough. And then it's stored. We also should really dive into whether blue balls are a myth, but that's a whole other episode.
Yes.
Another acronym that I didn't know the meaning of was AMH. She
Yes,
kept
I had
saying
this
that you
too.
could, you could test your AMH and that it's not necessarily a fertility test, it's a blood test, but what exactly does it tell you? AMH, which stands for anti-Mullerian hormone, says AMH is produced by the small undeveloped follicles in your ovaries, the ones holding immature eggs. When you have more of these follicles, your AMH level is higher. As you age and your egg supply naturally decreases, your AMH levels drops. So by measuring how much AMH is in your blood, doctors get a snapshot of roughly how many eggs are in the bank or in the pantry, as Dr. Lucky said, even though they can't tell the quality of those eggs. That is
Okay.
so
Egg
interesting.
count, not quality. Very interesting.
Correct. And Dr. Lucky also said there's no way to test for egg quality. They just
Yes. And
are
she
what
said
they are.
the only real fertility test is to have sex and try and get pregnant.
Yeah, right.
I'm like,
Exactly.
okay. Yeah.
And I appreciate that.
Don't fall for
essentially.
the Instagram scammers.
Correct. I know. So
Um,
apparently saliva testing, like I saw in the US, is not the case.
Not the case. Okay, if we rewind to the egg freezing part, what I wanted to know is we spoke about the injections, but I wanted to know what we are injecting into ourselves. So it says there are 3 typical injection lineups. The ovarian stimulation hormones, so it's FSH and LH, and these make multiple follicles grow at the same time so doctors can collect more eggs in one cycle. Number 2 is GnRH, antagonist or agonist. I am probably saying that wrong. But number 2, these prevent you from ovulating early before the egg retrieval procedure. Okay, so this part is what she was saying is you want it to grow inside you until they decide, they being your doctor, that it's ready to come out. They want it to mature inside you. And then finally is the trigger shot. And this is a human chorionic gonadotropin shot. Nailed it. This final injection matures the eggs and gets them ready to be collected. It's timed very precisely, usually 36 hours before retrieval. Okay, so those are your 3 shots. Make the follicles grow, make sure that they prevent you from ovulating so the egg can mature inside you, and then the trigger shot, which makes it come out at a very precise time.
One thing that she mentioned was when she said that when looking at fertility, she said, how do I explain this? Another
Honestly,
thing that
God forbid we are doctors. God forbid you and I go into the medical field. We're like, bleep, bleep, what is this Latin word? We
like
cannot.
at one point she said, how do I put this?
Like, so the sperm recreates as it ejaculates.
I go, they just can produce it whenever they come. I don't know. It's crazy. It's amazing. Science is crazy. Okay.
So I have a few takeaways here. So my big one was your health affects your ability to freeze quality eggs. She said when we spoke about fertility, ultimately she said one of the biggest factors right now is obesity. Next one was how many eggs you need depends on your age. We got this question. When you freeze your eggs, how many eggs are you looking for? It depends on you as a person. It's very individual. But she did say in your 20s, the quality of your eggs are at their peak. And so you can be successful with 10 eggs. She said when you get to your 30s, she's looking to retrieve 15 to 20 eggs. And at 38, you need 25 to 30. So it's a huge jump between freezing your eggs in your 20s and freezing your eggs in your late 30s. The quality of the eggs is the important part here, which is why you need more because the quality of your eggs deteriorate as you get older. We did have the question around when should you stop freezing your eggs? When is it too much? And she didn't say an exact number, but she did say the success of egg freezing drops off at 38. So after that, the numbers are really against you. So something to keep in mind. Other thing that's interesting is frozen embryos have a higher success rate to live births than frozen eggs. What specifically are those stats? Embryo stats are 97 to 98% chance of surviving the thaw. Post the thaw, have a 60 to 70% chance of a live birth. The rates for egg freezing, and this comes from the Southern California Reproductive Center, is women under 35 freezing 15 mature eggs gives about an 80% chance of at least one live birth. Women aged 35 to 37 freezing 20 eggs yields an 80% cumulative chance. Okay, and then 38 to 40, you need 30 eggs for a 75% chance of one live birth.
Wow. Okay.
Yeah, that's a lot of eggs. 30. Okay.
As always, speak to an actual expert.
To an
Don't
actual
take these
expert.
numbers.
This is coming from the Southern California Reproductive Center.
And yours truly.
Dr. Lucky did say you need to look at the success rates of the clinic you're going to and the doctor you're going to, and that point of you should, if you can, go to the same doctor you plan to have your IVF.
Second biggest takeaway, which maybe was more intuitive, but I didn't ever think of it this way, was that your fertility does not equal your egg count. Those are not one and the same. Your egg count is only relevant for egg freezing. So the amount of eggs in your pantry, so to speak, is important if you are freezing your eggs, because obviously the more you get, the more of a chance of success. But if you're just trying to get pregnant naturally, the amount of eggs in your pantry is irrelevant because your body naturally only releases one egg a month, and then that's your one shot to get pregnant naturally. So in my mind, I would have assumed a fertility test was my egg count, and those are not the same.
Okay.
right.
Very interesting. Last one for me was, it's a reality check that I think we are probably all scared of hearing, but it just seemed to be the case, where she said, the reality is we need to just be thinking about our timelines, because you can freeze your eggs, have great quality eggs that you're frozen, and you're like, fuck yeah, check this off the list, back to my career. But you still need to think about when you actually want to have kids, because as you get older, your ability to carry also decreases. So just having that in your mind, you can't just close your eyes, bury your head in the sand after you've frozen your eggs. It's not a 100% chance that you're going to be able to have a child if you want to with those eggs that you freeze. So that was kind of, I think, a good, at least for me, a good reality check that it's not your safe bet.
It's not the golden ticket to
No.
automatically having kids at any point that you choose, essentially. The other thing I think, and we didn't get into this with Dr. Lucky, we spoke about it in the intro, was the cost. Because I don't know what
Yes.
20-year-old in my life has $40,000,
Totally.
maybe $20,000 for one round, and is considering doing that just for this, for the security of it. So I think also just
Exactly.
the realistic, just being realistic about like who
Yeah.
is
Who can
starting to
afford to do
explore
this?
that and who can afford
Yeah.
to do that. Yeah, is
Yeah.
a big thing.
I feel like there's so much more to know on this topic, and we barely scratched the surface, even though we spoke for 60 minutes straight and barely took a breath, which is very interesting and exciting. There's so much more to learn, which is great.
Yeah,
More episodes to come.
exactly. Thanks for
Yay.
joining us. See you
Thanks for
next week.
tuning in.
Woohoo.
Yeehaw.